IVF treatment is a very long journey, and getting started might be the most difficult part of all. Once you get started, the process becomes relatively easier after the initiation of your treatment. However, taking the step forward for treatment is probably one of the most challenging points, one of the most challenging steps in the IVF treatment. Before you get started, it's very important that you make your research accordingly. It's very important that you understand what an IVF treatment is. It's very important that you understand what infertility is and what the treatment options are. Therefore, what we try to do as healthcare providers are we try to equip you with the technical knowledge and with the available evidence of clinical evidence or practice that we've been performing so that you can make an informed decision about your healthcare options. And it's very important that you are a part of this decision-making process. Therefore, before you get started, it's very important that you know your options. And then the next step becomes testing. Both for male and female testing, it is important that you are thoroughly screened for certain diseases, for certain conditions, and for certain possible reasons as to why that can explain why there is the problem of infertility. For patients who've been trying to conceive for some time, but are despite regular intercourse, it is important to start with male and female testing that might explain the reasons for infertility. For female testing, these include the hormone profile, such as the FSH, the LH, the estradiol, prolactin, TSH, and anti-Mullerian hormone to explain the path between the brain and the ovaries and how these are interacting and how these are working. For male testing, it is important to have a semen analysis, and based on the preliminary results of the semen analysis, further testing, more advanced sperm testing might be required. For patients who've tried IVF before, or for patients who've had recurrent miscarriages that are unexplained, it might be important to have some additional testing, such as thrombophilia testing and immune system testing to explain if there is an immune system related problem behind these miscarriages, and some additional testing for the male partner as well. So one prescription will not fit all. Therefore, we cannot provide a list of tests that are suitable for everybody. Your case is unique and it needs to be addressed by a healthcare provider, by a physician who understands your history very thoroughly.